Hello, good afternoon. My name is Ishaq Pathan. I'm the Bay Area Director at Islamic Networks Group, also known as ING. Thanks so much for joining us on our first panel in our series titled Solidarity in a Time of Crisis, Standing with Asian Americans. Today, we're going to be discussing what we need to know about the current situation and then addressing how we can take action. As you know, ING is a peacemaking organization dedicated to face-to-face education and engagement to foster understanding of Muslims and other misunderstood groups to promote harmony among all people. This series is an extension of one of our new programs, the Intercultural Speakers Bureau, which examines the roots of Islamophobia and other forms of bigotry, including anti-Blackness and anti-Semitism, and then recognizes the interconnectedness of all bigotry directed against Muslim, Jewish, Hindu, Sikh, Black, Latinx, Asian, and Native American populations. Without further ado, let's get started. I'd like to first introduce Cynthia Choi, the co-executive director of the Chinese for Affirmative Action, an advocacy organization and progressive voice on behalf of the broader Asian American and Pacific Islander community. This group advocates for systemic change that protects immigrant rights, promotes language diversity, and remedies racial injustice. Cynthia herself has led local, state, and national community-based organizations working on a range of issues, including reproductive justice, gender violence, immigrant refugee rights, and environmental justice issues. Cynthia, can you please start this by painting a picture of what the Asian American community in the United States is experiencing right now in light of COVID-19?
Well, thank you for the invitation to talk about what Asian Americans are facing during this pandemic. I want to start off by sharing stories, because stories is what connects us and brings this issue to life. My kids were at a park with their dad, who is white. An older white man pushed my 7-year-old daughter off her bike and yelled at my husband to take your hybrid kids home because they're making everyone sick. The person said, USA should blow up China, circulating his friend's post online. He also commented, I feel like Trump should use the nuclear bomb to finish China. My niece was at the local grocery store today, and this lady spat on an Asian family after insulting them by stating that the coronavirus was their fault. These are just a few personal experiences of hate among more than 1,200 that CAA and our partners received since this reporting center was established. Through our reporting center, we are hearing personal accounts of individuals who are encountering hate, running their essential errands, including taking care of their family and elders, and just trying to survive like everyone else during this difficult time. Since March 19th, when we started the center, we have received reports that follow these categories, a majority being verbal harassment, shunning, workplace discrimination, and physical assault. Children and youth are also being affected, either as perpetrators or as impacted individuals. In Texas, the FBI investigated a stabbing of a father and 2 children who are from Burma, and the assailant who's blamed them for this pandemic. This case harks back to the 1982 murder of Chinese American Vincent Chin, whose killers believed he was Japanese and responsible for the decline of the American auto industry. Sadly, this kind of racist resentment is a reoccurring pattern in American history, particularly during health crisis or in wartime. When the bubonic plague arrived in the 1900s, San Francisco's health department quarantined the city's Chinatown with barbed wire and ropes. And white citizens were allowed to travel about. 30,000 Chinese Americans were segregated and confined. During World War II, racist hysteria led to the unconstitutional relocation and imprisonment of over 120,000 Japanese Americans. And of course, after 9/11, Arabs, Muslims, and South Asians were subjected to scapegoating, and hate crimes against Muslim Americans surged during this period. This is a time that many Asian Americans are being fearful of just running to the grocery store, receiving medications at their pharmacies, living their lives, and again, trying to survive during this challenging period that has touched every single human being across the globe. Americans are fearing that Asian Americans are fearing that even when you wear a mask, that they're subject to physical attacks. And in our history, we have tried to figure out how to respond and try to fight discrimination. I think it's important that we lift up the fact that there has always been resistance. There has always been collective action. There has always been an effort to try to bring our communities together to show our humanity. And in response, this is exactly what we're doing. We're trying to raise awareness like we're doing today in this program. We are also trying to ask and demand that our governments are held accountable and respond to this crisis in the same way that they are trying to respond to this public health crisis. And finally, what I'd like to share is that we have to recognize that what Asian Americans are countering is no different from what other targeted communities are experiencing on a day-to-day basis. I'm including undocumented people, people of different faiths, the African American community, in particular, as you look at the ways in which our health disparities are showing up in this crisis. This has been a time for us to all come together to look at how we can address these issues with a racial equity lens, a lens that allows us to look at what are the underlying causes for racism to surge in these times of fear and anxiety that's cutting across the globe. And I'd like to just share our statistics. That really help to paint a picture that the types of discrimination overwhelmingly are verbal harassment, shunning. We are starting to see more incidents of physical assaults and also vandalism seems to be occurring. And you could see from our chart where these incidents are taking place. And they're currently restricted to where people are allowed to move about. And I think our greatest fear is when we are able to control this pandemic, what will happen when people return to work, when people start taking public transit, when our children return to schools. We need to be prepared as a community, as public agencies, and the private sector to be able to answer that call. So thank you very much for allowing us to share our work around Stop API Hate.
Sure, thank you so much, Cynthia. I'm so sorry to hear about the incident with your family. And this surge of bigoted incidents against the Asian American community is really horrible. Taking note and kind of elaborating on what you mentioned, what we're seeing in this moment is not new, but it's really a continuation of policies and actions towards Asian Americans and other groups. We're now going to transition to hear 4 leaders from the Asian American, Muslim American, Black American, and Jewish American communities who will share a little bit more about this. I'm going to introduce all of their bios and then we'll start with our first speaker. First, we'll hear from Dr. Hien, who is currently a professor of sociology at San Jose State University. Dr. Do received his PhD from the University of California, Santa Barbara in sociology. After Dr. Do, we'll hear from Maha Elgenaidi, the founder and director of the Islamic Networks Group, or ING, the organization bringing you this series today. Maha has a graduate degree in religious studies from Stanford University. Following Maha, we'll hear from Pastor Kaloma Smith, the pastor of University AME Zion Church in Palo Alto, California, and he was ordained in Mount Vernon, New York. And finally, we'll hear from Rabbi Melanie Aron, the rabbi of Congregation Shir Hadash in Los Gatos, California, who was ordained at the Hebrew Union College Jewish Institute of Religion. And just to note, after our speakers share their remarks, Cynthia will return to close on steps that we can take to counter our sphere of influence and what's going on. So I'm going to now pass it over to Dr. Doe to start us off. Thank you, Dr. Doe.
Thank you very much. Good afternoon, good morning, good greetings wherever you're coming from. I'm honored to be on this panel. One of the things that I really like about what Cynthia said was actually these personal stories. And I think it humanizes us in many ways. But I think that for me, one of the things that's really important is to try to understand sort of the long historical structural conditions that have led to all of this. When America was founded, it was supposed to be this experiment in democracy. And one of the ways in which this plays itself out is the idea of the tension between democracy and liberty. And so there's constantly been this kind of tension between those two ideas. Along with that, though, one of the things about the API community is that originally, and till today, at least still, they were brought in primarily for disposable labor, right? So if you look back at the Chinese immigration in the 1800s, it was primarily to help with the railroad constructions. And so one of the things that happens is that wave of Asian American immigrants have been brought in as labor to not really become part of our society. As a result of that, one of the things that sociologists look at and historians look at is, well, what are some of the laws and acts that we have passed to demonstrate the fact that for a long time, ever since they've arrived to these shores, that Asian Americans have not been included in this society. So if you go down, and I think Cynthia mentioned some of these things, we have the 1882 Exclusion Act. We have the 1907 Gentlemen's Agreement Act that stopped the immigration of Japanese Americans. We have the 1934 Tidings-McDuffie Act that prohibited or stopped the importation of Filipino migrants. And then, so that's sort of like this migration. And if you look at economically, one of the things that happens is that immigrants, and Asian in particular in this case, tended to be the scapegoat, right? So whenever there's a economic crisis, that we Americans tend to turn inward and look at a scapegoat. And historically, it's been communities of color. So if you look at all these laws that I said, and if you look at sort of the graph of when economic downturns happens and the increased violence toward Asian Americans, you can see that pretty clearly, right? So that's one of the things that I think is important. Now, the other thing is that this is nothing new. One way to think about that is that this has been a continuation of the ways in which we have been sort of treated. So Professor Takaki talked about the forever foreigner, that in effect, because of our sort of like a racial uniform, that we have not been allowed to participate. So we've always been seen as the other or painted as the other. And again, part of this is very simple to look at. If you want people to become part of our society, the one way to do that is to allow them to become citizens. But if you are labeling people as aliens ineligible for citizenship, that means in effect that you don't want them to become part of our society. And this historically has been the case. Now, if you move forward, one of the other things that happens is that in 1965, the United States of America tried to change its immigration policy in response to sort of this world pressure about us wanting to become this world power. So we have a new group of Asian immigrants coming in. And that in itself is interesting because the people that were brought in were very different from the original Asian immigrants, meaning that professionally, educational-wise, they were a lot higher. So as a result of that, you have sort of the development of smaller minority myth, right? And again, that creates a lot more tension, both in economics. So if you go back and look at Cynthia's graphs, one of the things that you would not expect is discrimination or acts against Asian Americans in the university in other settings. But yet that is the case. Cynthia brought up Vincent Chin in 1982. There's also a case in Leamington, a Vietnamese, second generation Vietnamese Americans who live in Tustin, California, who was also sort of discriminated and was act of violence against Asian immigrants. So one of the things that I think is really important is to sort of for us to think about economic downturns and scapegoating. Now, this case is a little bit different because this was not an economic downturn. It brought the economy to a halt, but it's also sort of emboldened by the president and the ways in which he articulates, right, how this virus is, instead of naming it the way that doctors sort of talk about it, he mentioned it as the China virus. And again, if you think at the violence against Asian immigrants, it's usually at a very, it happens very quickly. It's just below the surface, right? And that's one of the things that I think I want us to think about. And it's not just for Asian immigrants, it's also in terms of other communities as well. So one of the things that I think we need to do is to perhaps think about how do we create intersectionality? And I think that the other speakers will speak on some of these issues. So thank you.
Thank you so much, Dr. Doe, for providing kind of an overview of the history of this, which really demonstrates that it really is not new. It's not something that is, it's more of a surge. Maha, would you mind following Dr. Doe?
Sure. So thank you so much, Ishaq, for coordinating this and for the previous presentations by Dr. Doe and Cynthia. We're very grateful to you for joining us in this conversation. And I wanted to begin by saying that Muslims absolutely understand and sympathize with you and other Asian Americans who are experiencing hate crimes. And that's because we've been for some time now targets of hate crimes, as was pointed out, and of bigotry so intense that it's also impacted Sikhs, Christian Arabs, and other people who are mistakenly thought to be Muslim. And as has been pointed out, this is not a new problem for us. The Muslim experience of hate crimes, bullying of our children in schools, and general harassment, discrimination in the workplace goes back at least as far as the first Persian Gulf War in the early 1990s, and even before that, to the hate crimes Iranian Americans and Arab Americans experienced in the 70s during the Arab oil embargo and the hostage crisis in Iran that some of you are old enough to remember. What began in the last century as discrimination against Arabs and Iranians has now grown to the phenomenon that we call today Islamophobia, targeting not only Muslims, but anyone appearing to be Muslim, which makes it incredibly dangerous across various groups. Islamophobia has also determined US foreign policy towards Muslim majority countries, as we've seen with the war on terror. And this war in turn led to the spread of systemic discrimination against Muslims in places like India, that's currently happening by the BJP party, against Uyghur Muslims in China by the current government, and against Rohingya Muslims in Burma by its government. In the case of Muslims in particular, I have to pause and wonder, how did we get here? How did the nearly 2 billion Muslims today, who for centuries rivaled other civilizations in math and science, in literature, the arts, culture, become stereotyped as extremists and terrorists? And this is happening in the face of the fact that Muslim Americans today make up a large percentage of the medical field, of entrepreneurs who are building companies in Silicon Valley and elsewhere, of service workers, providing vital services throughout the United States, and all the charitable giving that we do. Why are Muslims still portrayed in much of America's popular culture as terrorists or extremists, when in fact, domestic terrorism today is perpetrated mostly by white supremacists? The answer to these questions is rooted, I believe, in, and I think it was pointed out by Dr. Doe as well, in colonialist history and this construction, this creation of biased narratives about Muslims and Arabs that continue to live with us today, and that have resulted not only in the killing of Muslims around the world, but also in undermining our own nation's values and ideals, as Americans continue to be invested in these false narratives about Muslims and other groups, while enacting and supporting policies such as the Muslim ban, racial profiling in airports, surveillance of mosques, and other Muslim institutions. Policies based on false ideas about an entire population threaten the civil liberties and well-being of all Americans. So all of us really have a stake in stopping bigotry and preventing hate like the hate Asian Americans, Black Americans, Latinx communities, Jewish Americans, Hindu Americans, and other groups are experiencing today. We'll talk more on that later in this webinar, and we're really going to delve into this topic in the second of the series of webinars. And I'll stop here. Thank you.
Thank you so much for portraying an overview of the ways in which what we're seeing now relates to the Muslim American and other communities as well. Pastor Kaloma, would you mind following Maha?
One of the significant challenges that we see is that once you see institutional racism go through generations in time, you will start seeing profound impact on populations. I'm so deeply saddened as I sit here with this in the middle of this pandemic and realize that in Chicago today, 70% of the people that have passed away have been Black. When racism becomes institutionalized in a country, whether it be Asian American, Muslim American, Black Americans, Jewish Americans, you start creating significant inequalities. The longer we let this trend that is currently happening to Asian American, it can profoundly impact generations in the future. Right now, as I sit here, I am just seeing the worst of America. As I listen to the language, I view the actions of the government seizing medical supplies, going from one place and sending it to others. It brings up questions of equity, parity, underlying racism, underlying Semitism, xenophobia, and we're seeing it acted out in the policies of the government. And that is what's so deeply profound. I believe that as people, we need to come together and advocate for each other. Because if we do not advocate for each other, who will advocate for us? I know that it's easy to get caught up in our own silos, focus on our own issues, focus on our own challenges. But I believe that in order for us to really move forward, the Asian American, the Jewish American, the Muslim American, the Black American community need to coalesce. Latinx community need to coalesce and address the biases that are ingrained and built into current American culture.
Thank you, Pastor Kaloma. Rabbi Melanie, would you mind closing off this panel section?
Thank you very much. And thank you to Cynthia and the other panelists for sharing really distressing personal reports and disturbing perspectives on what is going on right now in our country. Like the Asian community, the Jewish community has been the victim of restrictive immigration laws, particularly at a time in the middle of the 20th century when Jews around the world were in danger. We have had parallel experiences in the past with quotas on admission to institutions of higher education. Prejudice finds many targets. 100 years ago, when the so-called Spanish flu, which some scholars now believe came to the United States through Kansas, was afflicting the world, American newspapers on the West Coast blamed it on the Asian population, and on the East Coast on the Jews. Jews also share with the Black community and other religious minorities, having experienced attacks on our religious institutions, most notably in Pittsburgh and Poway. But this afternoon, I want to talk specifically about the response to COVID-19 and the scapegoating that has resulted from conspiracy theorists proclaiming that the virus is a tool of the Jews or that the Jews are profiting from it. For us as Jews, it is like falling into a hole and finding ourselves back in the Middle Ages. During the plagues of the 14th century, for example, Christians blamed Jews for the spread of the bubonic plague, and even in relatively benign environments like Spain, where Jews and Christians and Muslims had lived together for centuries, religious divisions resulted from these accusations. We fear now that the stereotypes and the memes of past generations about Jewish power and Jewish cunning will destroy the culture of diversity and inclusion, which has been what made America great. Unfortunately, we have seen too much of that already. including in the world of social media and Zoom bombing, which is affecting many groups. We worry that in a time of fear and economic dislocation, that these conspiracy theories will move from the fringes of our society into the mainstream. For that reason, programs like ours today are very important, and I thank ING for bringing this panel together.
Thank you, Rabbi Melanie. You know, it's really important to see panelists from all of your backgrounds standing together in solidarity to address what is going on. I think what we're really recognizing is that we're not going to be able to deal with the situation at hand unless we all stand together. Cynthia, can you tell us a little bit more about what audience members should do if they experience bigotry, and how others in a more privileged position can support them?
Well, first thing that I'd want to state is that one of the main reasons why we established the reporting center is we wanted to give voice to those who are experiencing hate. So often our experiences are trivialized and minimized. And I think we really wanted to, first and foremost, lift up those voices and to also paint this picture that this is happening at a scale and the extent in which it's happening. The slide showed that we had 1,200 incidents. Since we prepared that last report, we now have 1,600 incidents, and they're coming from all corners of the country. So while the huge number of cases are coming from places like California and New York, where there's significant API populations, we know that this is just the tip of the iceberg and that it's affecting everyone, including those high numbers of APIs who are healthcare workers and professionals who are also experiencing discrimination, to workers who are essential, delivering food, and grocery clerks, etc. So one of the things that we are working on now is providing resources for individuals who are encountering this type of hate. And so we are looking specifically at what to do if you encounter street harassment, and what to do if you witness somebody being targeted. And this applies to any individual, any group that's being targeted based on their nationality, religion, race, ethnicity, gender. One of the things that we have in our data analysis is that women are more than twice likely to be targeted, and there's a reason for that. It could be that women are more likely to report these incidents. It's also likely that women are targeted because of the perception that they are docile, that they won't fight back, that they will turn the other cheek, so to speak. So one of the things that we are trying to promote is this idea that, one, your physical safety is the most important, but should you choose to speak out, to do so in a way that first takes into account your safety, your sense of well-being, and to do it in a way that is affirming of who you are, and to not engage, but rather to try to de-escalate the situation. And it's perfectly fine to actually walk away from those situations entirely because of your sense of safety. You don't have a responsibility to educate every person that attacks you. And the same with the bystanders. We are asking anyone who witnesses this to stand by the person who's being targeted, meaning that one of the things that we know for sure is that those who choose to verbally harass, to target individuals, feel that that they're speaking on behalf of so many others. And so they feel emboldened, and they feel that they, have the license to speak out and to treat someone differentially. And so if we can have people stand up to drown out that type of behavior, that hatred, to say, no, you actually don't speak for me. This is wrong and you need to stop. These are sort of common sense things that individuals can do. But I do want to say that the most important thing is to lift up the fact that it's not up to individuals to address these structural, institutionalized forms of racism. Whether it's the president using their platform to sow hate and blame, and whether it's institutions that have not recognized the fact that there is racism and discrimination, and that this pandemic is exposing where those differences are, those disparities, is a wake-up call to each of us. So we have a responsibility, whether you're a faith leader, whether you are leading a nonprofit organization, or have agency within government levels, that we need to come together to think about not just anti-Asian hate, but how does racism, sexism, Islamophobia, how are these efforts to divide us how are we going to address those efforts that are really serving to divide us, is what I'm trying to say. So I think that this is a time for us to really think about both the individual and collective and institutional response that we need to see happen in this country.
Great, thank you, Cynthia. And just for our audiences, we will be supplementing all of the materials that speakers are talking about, including many things that you can do at home with resources on our website, including links and resources from other organizations as well. So please stay tuned for that, which should be up in the next few days on the same website, which I'll talk about later. Seeing that we have a little bit of time left, I'm wondering, I have a few questions, if you as panelists don't mind, especially for Cynthia and for Dr. Do. So the first question I have is that we have noticed a range of responses on how the Asian American community can address the situation. One in particular was a famous Asian American who wrote an editorial last week mentioning that Asian Americans need to exemplify their Americanness. How would you, Cynthia, and you, Dr. Do, how would you respond to that charge?
Cynthia, do you want to go first?
Why don't you go first, since I spoke so much?
Okay, thank you.
Okay.
So I think that that's a really interesting concept, and I think that most of us would disagree with what he says. I think that the Japanese American community actually tried to do that during World War II, and they were still incarcerated, right? They were taken and put to these concentration camps for 4 years, 5 years. And so it's not incumbent upon us to try to showcase that we're American, because of all those Japanese Americans, especially the second generation, were more Americans than Japanese. And I think that that sort of deflects the racism that takes place. So if you go back and look at the 1980s, when the commission did a study about why was it that Japanese Americans were put in concentration camps, they came out with two conclusions, right? The first one was because of political leadership failures, and two was because of racism. Both of those things continue to exist. So I think that though Andrew Yang, this is the person you're referring to, is trying to create something, and I think part of it is looking back in his background. So for example, Andrew Yang comes from a pretty privileged position, right? He grew up in the East Coast, he went to a pretty good school, he was successful, and he almost in some ways lived the American dream. And as a result of that, he doesn't understand, doesn't have the historical knowledge, the historical lens, the racist lens that I think a lot of us need to have growing up in this country of ours, to be able to really understand why it is that, as Cynthia mentioned, it's so easy for the government, the institutions, society to divide and conquer us, right? One way to think about this, who benefits from all of these things? And if you look at that, then you can think about what Pastor Kaloma talked about, which is that we have created generations of people who are going to be in poverty, and we continue to do that, right? And that's kind of the way that I think our society has operated. So for me, the one way to combat this, in addition to what Cynthia said, is right now, there are three things we can do. One is to make sure that all of us vote. That's really crucial. And you can see what happened in Wisconsin, right? In their attempt to not allow people to vote. Fill out the census. For all of our communities, the census, despite all the shortcomings that it has, is a way to distribute resources, and organizations that are dependent on the resources need to make sure that we have the numbers. And finally, participate and learn. So this panel, I think, allows us to really challenge people to think about our history and to think about history differently, right? To be able to understand why it is that we are where we are. So thank you.
Can I just jump in here for a second, Ishaq? And I just wanted to say that the next webinar is really going to delve into this history that I think is absolutely needed for people to understand how these narratives about different people gets constructed, gets created, and how it continues to be reinforced in society for centuries in all aspects of society. This is stuff that we did not create ourselves, but it's what we're living with, and we are inadvertently contributing to it as well, which is why we need to have this conversation. So I just wanted to sort of amplify the point that Dr. Doe just made.
Great. And
Yeah.
Cynthia.
I'll just add that I think Dr. Doe really broke it down, very well. I would just add that it's not surprising that that perspective exists. It's my parents' generation, and who believe that if you studied hard and you worked hard and you were the good immigrant, that life would fulfill itself, and that you could actually catch that and live the American dream. And I think on social media, he really did do a great job in uniting Asians to say that those of us who know our history know that that's not exactly how it fared out, for all the reasons that we stated before. And also, what I think is very problematic is that it somehow suggests that if we do all those things, that if disparities exist, it's because those others didn't work hard enough, didn't study enough, that they have cultural problems, that they don't value education. We have heard those types of stereotypes thrusted upon other groups as an effort to divide us and to deny that structural racism and institutionalized racism exists.
Mm-hmm.
And so that's the part that I feel very disheartened about. I understand it, but I'm disappointed because he's used his platform to set us back.
Mm-hmm. Did you want to say something, Pastor Smith?
Yeah.
Mm-hmm.
I see this as an immigrant myself. I very much share Cynthia's experience. When my parents came from Jamaica, the idea was to be this idealized or fictionalized American citizen. That you did all of these things and it would make you acceptable. The danger with this perspective is you now make the victim of structural and societal flaws the person that has to be the one that answers for it. So I believe that by saying we need to be more American-like, whether it be Muslim or Asian American or Black or Latinx or Jewish American, being more American-like is basically asking a victim of a crime to atone for the crime that was done to them.
Mm-hmm.
I believe a better approach is very much like what Cynthia is saying. We need to hold the mirror on culture and show them the ugliness of this behavior.
Yeah.
Because we cannot let things like physical and verbal abuse of people for any reason, particularly ethnicity, race, or gender, or religion, be the standard, and then we say we need to be, the other person needs to be better. So I commend Cynthia. I want to find ways to amplify her platform and put this information out. We have thousands of people that are dying, thousands of people, 1,700 yesterday, 2,000 today, and we have people that are finding ways to physically assault other people instead of trying to find ways to not have the death toll go up, not have people die. How can we help doctors? Their solution is to go attack people. This is not acceptable behavior, and we don't need to be better Americans. We need America to be better to us.
Thank you, Pastor Kaloma. And I know Rabbi Melanie also wanted to just share a brief word on that.
Just briefly, there's something very offensive about blaming the victim for what happens to a group of people. And the Jewish community has struggled with this. I remember my grandmother, be quiet, be cultured, be good, all these things, and then the non-Jewish world will be more accepting. But if you look at anti-Semitism, Jews were criticized for being communists and criticized for being capitalists. Jews were criticized for assimilating and sneaking into the culture, and they were criticized for being clannish and hanging together. There's nothing rational about this kind of racist hatred. And so the blaming of the victim, the idea that if we were only a little bit more something else, it wouldn't exist, is really absurd, and all of us can stand together on that.
Thank you. There are a few other questions that are on the chat, and in the interest of time, I'm only going to ask one more. And I will mention that there is a question on the mono-minority myth, and panelists will discuss that a little bit later in next week's session. There's also a question on how to address racism when expressed by people who have power over us. I want to invite panelists to also talk about that next week, because power is a huge play when it comes to challenging one another. But just in the interest of time and for the sake of clarification as well, there's a question for Cynthia, which is, how did your husband handle that situation involving your daughter? How do you console your daughter? A lot of us are dumbfounded when facing that kind of situation. We don't know how to respond. We feel defenseless. What do you suggest we do and when? And you addressed some of this, but I think you might want to clarify a little bit of that.
Well, the first clarification is that didn't actually happen to me personally. I was reading a firsthand account of an incident report that we received. And in terms of how that gets addressed, I think those are horrible, horrible situations. And in particular, I'm thinking about the 7-year-old child and the conversation that you as a parent or any adult who has to respond in the aftermath. If you remember Andrew Yang's piece about, I'm so glad my son wasn't with me when he encountered hate, because then I would have had to address it. And I wonder, what would he have said to his child? And the way that I think about it, because my daughter actually, who was trying to sneak into our webinar, is 10 years old. And I thought about, she's seen me do these interviews. We talk about the work that I'm doing, why we started this reporting center, because that's the kind of family we are. We talk about things that are happening in our community around the world at dinner. And it's a conversation that we have a lot, which is, it's important to really pay attention to where your children are, what they're experiencing in their emotions, and to explain that this is part of what we need to do to understand. One of the things that she reminds me of is she often tells me that my work is very, very scary and sad. And one of the things that I talk to her about is that actually I feel very hopeful because we can actually do something about it. So I think about the conversations that we have to have with our children. And I want to say that moving forward, even long after this pandemic is contained, We are going to have to equip teachers and schools to really be able to address the mental health issues and concerns that are coming out of this. How do you have conversations with children in a very scary time, obviously age appropriate? There are anti-bullying prevention programs in schools that exist across the country. So how do we integrate this manifestation or this form of it? So on an institutional level, I think those are things that we need to do. And on a personal level, my responsibility and all of our responsibilities are for our own safety and for our families, and to really be able to not respond to those types of incidents, because it can get very elevated, and in some instances, it could lead to greater physical attack and harm. So I've always said our responsibility is to ourselves and our safety, and that's what we try to advocate.
Thank you so much, Cynthia. And as we close this panel, thank you to all of you for such an inspiring and an important session today, and a great display of solidarity as well. I really appreciate your time with us this afternoon, and I appreciate the time of all of the people who are tuned in to watch. I also want to recognize that we are on the eve of Passover, so Rabbi Melanie, Aron, please, I wish you a wonderful Passover week and season. And then we are just a few days away from Easter, and so Pastor Kaloma, I wish you a healthy and happy Easter. If you have any questions in the audience, you can feel free to leave them in the chat. As I mentioned, this is the first of 2 webinars. And so our second webinar is next Wednesday, April 15th from 6 to 7 p.m. So notice the time change there. And it's going to be on a history of bigotry against Asian Americans, what we need to do about it now. And so this is a time where our 4 panelists from these different communities will talk a little bit more about the roots and the history of these things, to really show that what we're experiencing now is not new. And then in order to challenge it now, we need to understand where it came from and the underlying roots behind it.
Can I just add something, Ishaq,
yeah.
really quickly, and just to say that we're also going to be looking at the intersectionality that Dr. Do brought up on how the bigotry against Asian Americans is directly related to anti-Blackness, anti-Semitism, anti-Muslim bigotry, anti-Latinx, and so forth. And we're going to break down when Pastor Kaloma talked about institutionalized racism. We're going to break that down to demonstrate how this happens. How is it that the Black community continues to struggle and experience the racial disparities in healthcare and all sorts of services? We're gonna show you how that functions, because it's important for the public to know about this, to be able to dismantle it, to be able to address it. And so that's what you can expect at the in the next session. And I wanted to also tell Cynthia that this program, the Intercultural Speakers Bureau, which is a new bureau for ING, is actually funded by a few foundations that I want to name right now. Haas Foundation is one, another is the San Francisco Foundation, and another that put in the majority of the funds is the Silicon Valley Community Foundation. I want to really thank them so much for taking a chance on us to be able to do this work. And part of the funding is to create these lesson plans, and we're working with Stanford School of Education on this, to create the lesson plans that can go into the classroom so that the teacher has the tools to be able to address these issues. In talking about, why is it that we have these perceptions that we do? Why is it that we react the way that we do? For example, I was recently traveling before the coronavirus, and a woman who I sat next to told me that I got to tell you that when I saw you boarding the plane, I called my daughter and I panicked, and I didn't want to board the plane because I told her that one of them is boarding with me. And I was really frightened by the fact that, knowing that you're a Muslim, that you were going to fly the plane with me. I don't know this woman. I'm an American like any other American. Why would you have these perceptions? Well, that's the kind of conversation that I think we need to have. Why do we viscerally react to people that are different from us? And that's the interesting conversation that I think America needs to have, all of us together. So I just wanted to throw that in there.
Thank you, Maha. So with that, we have some information on that webinar on the website at www.ing.org/intercultural series. And on there, probably tomorrow or the next day, you will see supplemental resources from things that panelists mentioned today, particularly on what audiences can do when experiencing bigotry themselves, when witnessing bigotry, and then just proactively and preventatively as well. If you have any questions or comments, you can type them in the chat here or email mail@ing.org. Again, I want to thank all of you, our panelists and our viewers, for being here. And I would like to wish you all a wonderful rest of your day. And in recognition that April is a time where many traditions have some sort of holy period, whatever that is for you all, I wish it be well and healthy. Thank you all, and have a good day.